You are the nurse taking care of a patient who is started on trimethoprim, sulfamethoxazole for a urinary tract infection. When counseling the patient about possible side effects, you offer which of the following statements? A. Do not take fish oil while taking trimethoprim, sulfamethoxazole. B. Do not eat bananas while taking trimethoprim, sulfamethoxazole. C. If you notice a skin rash, please call your physician immediately, and if nobody answers, go to the nearest emergency department. D. Avoid contact sports while taking trimethoprim, sulfamethoxazole. E. Do not operative heavy machinery or motor vehicles while taking trimethoprim, sulfamethoxazole. The answer is C. If you notice a skin rash, please call your physician immediately, and if nobody answers, go to the nearest emergency department. A rare, but potentially fatal side effect of trimethoprim, sulfamethoxazole is a severe skin rash called Stevens-Johnson syndrome. This rash results in death of the cells of the epidermal skin layer, and results in their separation from the dermal skin layer. It occurs for a handful of reasons, but most commonly is a hypersensitivity reaction in the skin and mucous membranes to medications, such as trimethoprim, sulfamethoxazole or antiepileptics. It is a true medical emergency. Thus, if any patient taking trimethoprim, sulfamethoxazole experiences a new skin rash, they should call their prescribing physician immediately, and if no one answers, they should proceed to the nearest emergency room. Neither fish oil, nor banana consumption are contraindicated in patients taking trimethoprim, sulfamethoxazole. Trimethoprim, sulfamethoxazole does not typically have any appreciable effects on one's ability to operate heavy machinery, motor vehicles, or play contact sports. Which of the following heart medications is most likely to cause a chronic dry cough? A. Hydrochlorothiazide. B. Nolol. C. Amlodipine. D. Enalapril. E. Losartan. The answer is D. Enalapril is an ACE, angiotensin-converting enzyme, inhibitor. One of the most commonly reported side effects of ACE inhibitor use is a chronic dry cough. This is likely due to the medication's inhibition of kininase 2, a CE, which results in a buildup of kinins in the respiratory tract. None of the other medications listed are associated with persistent cough. What is the antidote for overdose of warfarin? A. Heparin. B. Vitamin K. C. Protamine sulfate. D. IV magnesium. The answer is D. Vitamin K. The proper antidote for overdose of warfarin is vitamin K. Heparin will not reverse the effects of too much warfarin, it would only aggravate the problem. Protamine sulfate is the antidote for overdose of heparin. IV magnesium may be used to antidote digoxin if digobind is unavailable. Which of the following is an adverse effect in the client being treated for hypertension with enalapril? A. Nausea. B. Insomnia. C. Swelling of the tongue. D. Dry cough. The answer is C. Swelling of the tongue. A swelling of the tongue indicates that a client may be allergic to enalapril. Other indicators include rash, hives, itching, difficulty breathing, and tightness in the chest. Which of the following medications is a non-selective beta-adrenoceptor and alpha-adrenergic blocker? A. Carvedilol. B. Lisinopril. C. Amiodarone. D. Clonidine. The answer is A. Carvedilol. Carvedilol is a non-selective beta-adrenoceptor and alpha-adrenergic blocker. Lisinopril is an ACE, angiotensin-converting enzyme, inhibitor. Clonidine is an alpha-adrenergic agonist, and amiodarone is a sodium channel blocker. You are a nurse working on an inpatient medicine floor. One of your patients is advised to discuss starting gamfibrozil, a fibrate medication, after he is discharged. Which of the following best describes the mechanism of action of gamfibrozil? A. Vitamin K-dependent clotting factor synthesis inhibition. B. HMG-CoA reductase inhibition. C. Alpha-adrenergic inhibition. D. Beta-adrenergic inhibition. E. Peroxisoproliferator activated receptor, PPAR, activation. The answer is E. Peroxisoproliferator activated receptor, PPAR, activation. This is the accurate mechanism of action for fibrate medications, such as gamfibrozil. Fibrates are commonly used medications used to treat high cholesterol, as well as a number of other metabolic abnormalities in patients. Fibrates have the relatively unique property of lowering LDL, the bad cholesterol, increasing HDL, the good cholesterol, and lowering triglycerides, making them a popular choice when administered either alone, or with statin medications for patients with hypercholesterolemia. HMG-CoA reductase inhibition is the mechanism of action of statins. Vitamin K-dependent clotting factor synthesis inhibition is the mechanism of action of warfarin. Alpha-adrenergic inhibition is the mechanism of action of phenoxybenzamin, among other medications. Beta-adrenergic inhibition is the mechanism of action of propranolol, among other medications. When used with statins, There is a tendency for myositis and rhabdomyolysis. Hence it is advised that patients be advised of this adverse effect and asked to report promptly any muscle pain, weakness or tenderness, particularly if accompanied by fever, malaise or dark urine. Rhabdomyolysis is characterized by plasma creatinine kinase greater than 20,000 IU per L, myoglobinuria and extreme muscular pain, occurs in about 1 in 250,000 patients and is commoner in females, the elderly. Hypothyroidism. If CK is significantly elevated, greater than 5 times the ULN, or if myopathy is suspected, then treatment should be stopped, while the patient is monitored for muscular symptoms and cardiovascular risk. You are the nurse taking care of a patient hospitalized for a deep vein thrombosis. You are reviewing his discharge medications, and counsel him about the benefits and risks associated with apixaban. Which of the following is a major possible adverse effect associated with apixaban? A. Thrombosis. B. Constipation. C. Ischemic stroke. D. Myocardial infarction. E. Bleeding. The answer is E. Bleeding. Apixaban is a novel anticoagulant medication that functions by directly inhibiting factors in the clotting cascade. You can remember this mechanism of action by noting the letters 10A. In apixaban. Apixaban is used with increasing frequency now in the treatment of deep vein thrombosis, pulmonary embolism, and atrial fibrillation. A very serious potential adverse effect of apixaban though is that since it is an anticoagulant agent, it can predispose to serious bleeding events. Furthermore, one of the biggest dangers of apixaban is that there is no readily available antidote for it yet, and as such if a bleeding event occurs, there is no simple way to reverse it, as there is with other anticoagulants like warfarin or heparin. Thrombosis, myocardial infarction, and ischemic stroke are all typically thrombotic, for example clot-related, issues. Apixaban may be used in the treatment of conditions associated with clotting, but is not known to cause clots, as it is an anticoagulant. Apixaban has no known association with bowel movement frequency. You are a nurse taking care of a patient during a rapid response call. The patient is bradycardic and you are asked to administer atropine. Which of the following best describes the mechanism of action of atropine? A. Beta-adrenergic blocker. B. Muscarinic acetylcholine receptor agonist. C. Muscarinic acetylcholine receptor antagonist. D. Alpha-adrenergic blocker. E. Monoaminoxidase inhibitor. The answer is C. Muscarinic acetylcholine receptor antagonist. Atropine is an anticholinergic medication used for a number of reasons, including to treat bradycardia, various nerve agent poisonings, and intraoperatively at times to diminish the amount of saliva generated. Typical anticholinergic medication side effects can be associated with atropine including pupil dilation, urine retention, dry mouth, constipation, and tachycardia. Muscarinic acetylcholine receptor agonist is incorrect as this is the opposite of how atropine works. Beta-adrenergic blocker is incorrect. This class of medications would actually serve to decrease heart rate, which would be highly dangerous in a patient whose reason for intervention is bradycardia. Neither alpha-adrenergic blockade nor monoaminoxidase inhibition describes the mechanism of action of atropine. You are the nurse taking care of a 78-year-old female who is in atrial fibrillation with rapid ventricular response. She is started on metoprolol and diltiazem. Which of the following best describes the mechanism of diltiazem? A. Mu opioid receptor agonist. B. Calcium channel blocker. C. Beta adrenergic blocker. D. Alpha adrenergic blocker. E. Mu opioid receptor antagonist. The answer is B. Calcium channel blocker. Diltiazem, which is more specifically a non-dihydropyridine calcium channel blocker, is a commonly given medication that functions to dilate both coronary and peripheral vessels, with a negligible reflex adrenergic response. It also is useful in reducing cardiac contractility, having negative inotropy, chronotropy, and dromotropy characteristics. The other choices are incorrect. Beta adrenergic blocker is the mechanism of action of metoprolol. Alpha adrenergic blocker is the mechanism of action of doxycycline. Mu opioid receptor agonist is the mechanism of action of morphine. Mu opioid receptor antagonist is the mechanism of action of naloxone. The answer is A. Taper the medication to avoid discontinuation syndrome. Clients taking paroxetine may experience withdrawal and continuation syndrome. To minimize symptoms, taper the medication over a period of 3 or more weeks. A client has been taking daily doses of paroxetine for 6 months and has asked for an information with the nurse about going off the medication. What should the nurse emphasize in the information session? A. Taper the medication to avoid discontinuation syndrome. B. Advise the patient of probable weight gain after going off the medication. C. Stop taking the medication immediately. Increase physical activity level for 2-3 weeks to counteract side effects. D. Urge the client to continue taking the medication until he consults a psychotherapist. What type of antidepressant is fluoxetine? A. Monoamine oxidase inhibitors, MAOI. B. Norepinephrine reuptake inhibitor, NRI. C. Selective serotonin reuptake inhibitor, SSRI. D. Tetracyclic antidepressant. The answer is C. Selective serotonin reuptake inhibitor, SSRI. Fluoxetine is an example of a selective serotonin reuptake inhibitor, SSRI. SSRIs limit the amount of serotonin that the presynaptic cell that secreted it can reuptake. This increases the time and amount that serotonin is in the synaptic cleft and bound to postsynaptic receptors, leading to antidepressant properties. The other drugs are all antidepressants, but are sold under other names. What drug class is clomipramine? A. Serotonin modulator and stimulator, SMS. B. Selective serotonin reuptake inhibitor, SSRI. C. Monoamine oxidase inhibitor, MAOI. D. Tricyclic antidepressant. The answer is D. Tricyclic antidepressant. Clomipramine is a tricyclic antidepressant. Drugs in this class function primarily by blocking serotonin and norepinephrine transporters, resulting in an increase in the levels of these neurotransmitters in the synapse, and thus an increase in their effects due to staying bound to postsynaptic receptors for longer. What class of drug is trazodone? A. Tricyclic antidepressant. B. Tetracyclic antidepressant. C. Serotonin antagonist and reuptake inhibitor, SARI. D. Norepinephrine reuptake inhibitor, NRI. The answer is C. Serotonin antagonist and reuptake inhibitor, SARI. Trazodone is a serotonin antagonist and reuptake inhibitor. These drugs work by increasing the release and inhibiting the reuptake of serotonin in the synaptic space, thus increasing the effect of serotonin. Aripiprazole is what class of drug? A. Selective serotonin reuptake inhibitor, SSRI. B. Atypical antipsychotic. C. Serotonin norepinephrine reuptake inhibitor, SNRI. D. Serotonin modulator and stimulator, SMS. The answer is B. Atypical antipsychotic. Aripiprazole is an atypical antipsychotic. It acts as a partial dopamine agonist and an agonist to multiple 5-HT, serotonin, receptors. What class of drug is quetiapine? A. Serotonin antagonist and reuptake inhibitor, SARI. B. Norepinephrine reuptake inhibitor. C. Tricyclic antidepressant. D. Atypical antipsychotic. The answer is D. Atypical antipsychotic. Quetiapine is classified as an atypical antipsychotic. Quetiapine is a powerful antihistamine and has pharmacological action at many receptor types. It is a serotonin, dopamine, and adrenergic antagonist. Which of the following antidepressants is also used for smoking cessation? A. Bupropion. B. Venlafaxine. C. Amitriptyline. D. bus by your own? The answer is A. Bupropion. Bupropion is an antidepressant used for smoking cessation. None of the other medications listed are used for smoking cessation. Sertraline, paroxetine, and citalopram are all classified as what type of antidepressant? A. Selective serotonin reuptake inhibitors, SSRIs. B. Serotonin modulator and stimulators, SMSs. C. Monoaminoxidase inhibitors, MAOIs. D. Serotonin norepinephrine reuptake inhibitors, SNRIs. The answer is A. Selective serotonin reuptake inhibitors, SSRIs. Sertraline, paroxetine, and citalopram are all selective serotonin reuptake inhibitors, SSRIs. This class of drug works by blocking serotonin reuptake in the synapse, thus increasing postsynaptic serotonin stimulation. They are one of the most widely used class of antidepressants in the United States and many parts of the world. Zolpidem belongs in what drug class? A. Non-benzodiazepine hypnotic. B. Benzodiazepine. C. Selective serotonin reuptake inhibitor, SSRI. D. Orexin antagonist. The answer is non-benzodiazepine hypnotic. Zolpidem is a short-acting non-benzodiazepine hypnotic. Its actions are similar to benzodiazepine drugs in that it stimulates GABA receptors at the same location as benzodiazepines. It is used in insomnia for initiating sleep, though its short half-life, 3 hours, means it is not generally considered effective for maintaining sleep. All of the following are common anticonvulsants except dash. A. Carbamazepine. B. Lamotrigine. C. Valproate. D. Risperidone. The answer is D. Risperidone. All of the answers given are common anticonvulsant medications except risperidone, which is a second-generation, atypical antipsychotic used in schizophrenia and bipolar disorder. Lamotrigine carries a black box warning about what side effect? A. Dress syndrome, drug reaction, rash with eosinophilia and systemic symptoms. B. Stevens-Johnson syndrome. C. Aseptic meningitis. D. All of these. The answer is D. All of these. Lamotrigine carries a black box warning about the following side effects: Stevens-Johnson syndrome, toxic epidermal necrolysis, dress syndrome, drug reaction, rash with eosinophilia and systemic symptoms, aseptic meningitis. Phenelzin is what class of drug? A. Monominoxidase inhibitor, MAOI. B. Tricyclic antidepressant. C. Alpha-adrenergic agonist. D. Narcotic. The answer is A. Monominoxidase inhibitor, MAOI. Phenelzin is a monominoxidase inhibitor, MAOI. Drugs in this class work by inhibition of monominoxidase enzymes, the enzymes responsible for the breakdown of serotonin, dopamine, and adrenaline. What class of drugs is diazepam? A. Non-benzodiazepine sedative. B. Benzodiazepine. C. Methaqualone analog. D. Barbiturate. The answer is B. Benzodiazepine. Diazepam is a benzodiazepine. This class of drugs works by potentiating the effects of GABA, our primary inhibitory neurotransmitter, at the GABA-A receptor. Bromocriptine belongs to what class of drug? A. Peripheral dopamine decarboxylase inhibitor. B. Anxiolytic. C. Anticholinergic. D. Dopamine agonist. The answer is D. Dopamine agonist. Bromocriptine is a dopamine agonist used in the treatment for Parkinson's disease, pituitary tumors, and type 2 diabetes. A patient taking haloperidol complains of abnormal, unintentional movements of his tongue and face. The nurse knows that the patient is experiencing which of the following side effects of haloperidol? A. Convulsions and seizures. B. Neuroleptic malignant syndrome. C. Increased anxiety. D. Tardive dyskinesia. E. Dizziness and weakness. The answer is D. Tardive dyskinesia. All of the listed options are side effects of haloperidol, but tardive dyskinesia is the only one that manifests with involuntary, dyskinetic movements in their face, lips, tongue, trunk, and extremities. Tardive dyskinesia more frequently occurs among elderly female patients taking long-term dopamine antagonist medications. Dizziness, weakness, convulsions, seizures, and anxiety are also side effects of haloperidol. Neuroleptic malignant syndrome presents with fever and high, unstable blood pressure, muscle cramps and tremors, altered mental status, such as delirium, agitation, or a coma. You are the nurse taking care of a patient who is experiencing a panic attack. You are instructed to give the patient a dose of lorazepam. Which of the drug classes below describes lorazepam? A. Barbiturate. B. Alpha blocker. C. Beta blocker. D. Benzodiazepine. E. Amphetamine. The answer is D. Benzodiazepine. The correct answer is benzodiazepine, as lorazepam, also known as Ativan, is a benzodiazepine drug. Benzodiazepines act by increasing the efficacy of the neurotransmitter, GABA, when it acts upon its particular receptors. They have potent anti-anxiety properties, among other properties, and are frequently given during the initial phase of a panic attack to calm the patient. On the other hand, the other choices are incorrect. Phenobarbital is an example of a barbiturate. Propranolol is an example of a beta blocker. Tamsulosin is an example of an alpha blocker. Methamphetamine is an example of an amphetamine. Metoclopramide is used in the treatment for which of the following conditions? A. Ulcer disease. B. Tuberculosis. C. Chronic bronchitis. D. Vomiting after chemotherapy. The answer is D. Vomiting after chemotherapy. Metoclopramide is an antiemetic and gastroprokinetic agent commonly used to treat nausea and vomiting, to facilitate gastric emptying in people with gastroparesis, and as a treatment for the gastric stasis often associated with migraine headaches. Fluorouracil is used to treat which of the following conditions? A. Myasthenia gravis. B. Rheumatoid arthritis. C. Colorectal, breast, and ovarian cancer. D. Ulcerative colitis. The answer is C. Colorectal, breast, and ovarian cancer. 5-fluorouracil is a fluoropyrimidine analog which inhibits translation, synthesis, and function of RNA and DNA, thus slowing down cellular metabolism. It is used in treatment of colorectal, breast, and ovarian cancer, in addition to cancers of the GI and head and neck. Which of the following laboratory values would indicate toxicity in the client taking acetaminophen daily? A. Sodium level of 140 milliequivalent per liter. B. Direct bilirubin level of 2 mg per deciliter. C. Prothrombin time of 12 seconds. D. Platelet count of 400,000 per cubic millimeter. The answer is B. Direct bilirubin level of 2 mg per deciliter. A direct bilirubin level of 2 mg per deciliter or greater indicates acetaminophen toxicity. The purpose of misoprostol in a client who chronically uses non-steroidal anti-inflammatory drugs, NSAIDs, is A. Decrease in serum phosphorus level. B. Relief of epigastric pain. C. Reduction of steatorrhea. D. Increased white blood cell count. The answer is B. Relief of epigastric pain. Misoprostol is used for the prevention of non-steroidal anti-inflammatory drug, NSAID, induced gastric ulcers. Taking this drug will prevent gastric ulcers and relieve epigastric pain. Clinically, abdomen is divided into 9 zones. Epigastrium is the part of the abdomen immediately over the stomach. It is located between the costal margins and the subcostal plane. The epigastric, above stomach, region contains the majority of the stomach, part of the liver, part of the pancreas, part of the duodenum, part of the spleen, and the adrenal glands. During breathing, the diaphragm contracts and flattens, displacing the viscera and producing an outward movement of the upper abdominal wall, epigastric region. It is a convergence of the diaphragm and the rectus abdominis, so that when both sets of muscles, rectus abdominis, tense, the epigastrium pushes forward. It is also the spot where the Heimlich maneuver is able to produce a rapid and forceful exhalation of breath.
Which of the following analgesics is available in lollipop form? A. Hydrocodone. B. Excicodone. C. Tramadol. D. Fentanyl. The answer is D. Fentanyl. Fentanyl citrate comes in solid form on a stick, often referred to as a fentanyl lollipop. This form is 8,100 times more potent than morphine and intended for use by cancer patients and patients that have become tolerant to opioids. Celecoxib is what class of drug? A. Muscle relaxant. B. Narcotic. C. Non-steroidal anti-inflammatory drug, NSAID. D. Corticosteroid. The answer is C. Non-steroidal anti-inflammatory drug, NSAID. Celecoxib is a non-steroidal anti-inflammatory drug, NSAID. These drugs work by inhibiting cyclooxygenase 1, COX-1, and cyclooxygenase 2, COX-2, which reduces the synthesis of pro-inflammatory prostaglandins and thromboxane. Which of the following is an antidote to opioid overdose? A. Naloxone. B. Flumazenil. C. Inositolcysteine. D. Glucagon. The answer is A. Naloxone. Naloxone antidotes opioid overdose by competitively binding to mu-opioid receptors. Flumazenil is an antidote to benzodiazepines. Glucagon is an antidote for beta-blocker overdose. Inositolcysteine is an antidote for acetaminophen. Which of the following over-the-counter analgesics is one of the most common causes of liver failure in the United States? A. Acetaminophen. B. Ibuprofen. C. Aspirin. D. Naproxen. The answer is A. Acetaminophen. Acetaminophen in doses over 3,000 mg per day can result in significant liver damage or liver failure. From 1998 to 2003, acetaminophen was the leading cause of acute liver failure in the United States. According to a population-based report in 2007, there are an estimated 1,600 cases of acute liver failure in the United States every year, with acetaminophen being the most common etiology. Levodopa is not generally given alone due to what side effects? A. Nausea, vomiting, and anorexia. B. Delirium. C. Heart palpitations. D. Tremor. The answer is A. Nausea, vomiting, and anorexia. Levodopa, L-DOPA, a common treatment for Parkinson's disease, is generally given in combination with carbidopa or another peripheral dopa decarboxylase inhibitor. This is because levodopa alone will stimulate dopamine receptors in the GI tract and the chemotrigger receptor zone, CTZ, in the brain, resulting in nausea, vomiting and anorexia. A peripheral dopa decarboxylase inhibitor prevents levodopa from being prematurely converted into dopamine in the adrenal glands or other peripheral tissues. How does adalimumab function to reduce inflammation in rheumatoid arthritis? A. Cyclooxygenase 1, COX-1, and cyclooxygenase 2, COX-2, inhibitor. B. Tumor necrosis factor alpha inhibitor. C. Monoclonal antibody. D. More than one of these. The answer is D. More than one of these. Adalimumab is a tumor necrosis factor alpha, TNF-alpha, inhibitor. This class of drugs suppresses response to TNF-alpha, a potent pro-inflammatory cytokine. Inhibition of folic acid metabolism is the method of action of methotrexate. Reversible inhibition of COX-1 and COX-2 is the mechanism of nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen. Rheumatoid arthritis drugs such as rituximab, and almost all drugs that end in mab, including adalimumab, function as monoclonal antibodies. Which of the following analgesic medications should be used with caution in patients with hepatic disease? A. Acetaminophen. B. Ibuprofen. C. Ketorolac. D. Meloxicam. E. Naproxen. The answer is A. Acetaminophen. Acetaminophen, also known as Tylenol, is initially metabolized into a hepatotoxic intermediate. It transiently becomes a reactive oxygen species, which can cause liver hepatotoxicity. As such, in patients who already have pre-existing liver disease who are already more prone to liver injury from substances and diseases that affect the liver, it is prudent to avoid medications like acetaminophen that have a known potential to cause liver damage. Meloxicam, ibuprofen, naproxen, and ketorolac are all examples of NSAIDs. These medications have the potential to cause renal damage or gastrointestinal damage if used in excess, but do not have the known hepatotoxic properties that acetaminophen does. You are the nurse taking care of a patient who is started on a 2-week course of oral prednisone. Which of the following is a known side effect of oral steroids? A. Hypotension. B. Hyponatremia. C. Insomnia. D. Decreased appetite. E. Hyperkalemia. The answer is C. Insomnia. The correct answer is insomnia, as steroids are known to increase patients' vigilance and energy levels, thereby frequently making it difficult for patients to fall asleep and/or stay asleep while taking their steroid medication. The other choices are incorrect. Decreased appetite is not a side effect of taking steroid medications. Patients on steroids often have increased appetite. Hyponatremia and hyperkalemia both are not side effects of taking steroid medications. Hypernatremia and hypokalemia are more common side effects of steroids. Hypertension, rather than hypotension, is a known side effect of steroid use. You are the nurse taking care of a patient with severe lower back pain. He is being treated with oxycodone and hydromorphone. Which of the following analgesic medications produces dilated pupils? A. Mepridine. B. Morphine. C. Hydromorphone. D. Acetaminophen. E. Oxycodone. The answer is A. Mepridine. Mepridine, a potent opiate analgesic, also known as Demerol, is one of the only opioids that produces dilated pupils, rather than constricted, pinpoint pupils. A way to remember this is to remember the phrase, Demerol dilates. The other choices are incorrect. Acetaminophen has no known effect on pupil size. Morphine, oxycodone, and hydromorphone, all opiate analgesics, are known to constrict the pupils. Demerol dilates. Demerol dilates. Demerol dilates. You are the nurse taking care of a patient who is hospitalized for severe lower back pain. The patient also has a medical history significant for multiple gastrointestinal bleeds and peptic ulcer disease. Which of the following medications should be used with extreme caution in this patient given his medical history? A. Oxycodone. B. Morphine. C. Hydromorphone. D. NSAIDs. E. Acetaminophen. The answer is D. NSAIDs. This is the correct answer because NSAIDs are known to be irritants of the gastrointestinal tract, and prolonged and/or extensive use of NSAIDs can increase the risk of developing gastrointestinal ulcers, as well as consequent gastrointestinal bleeds in the setting of ulcers. NSAIDs reduce the production of the hormone prostaglandin. One of the things prostaglandin does is increase the production of gastric, stomach, mucus and substances that neutralize stomach acid. If there is too little prostaglandin, the stomach lining becomes more susceptible to damage from stomach acid. The other choices are incorrect. Acetaminophen is not known to increase the risk of gastrointestinal bleeding or peptic ulcer formation. Morphine, oxycodone, and hydromorphone are all opiate analgesics and are not known to increase the risk of gastrointestinal bleeding or peptic ulcer formation. The home health nurse reviews the types of insulin prescribed to the client diagnosed with diabetes mellitus type 1. Which of the following insulins experiences peak action between 6-12 hours? A. Glargine. B. Lispro. C. Regular. D. Isophene, NPH. E. Aspart. The answer is D. Isophene, NPH. It is essential for the nurse to know the onset, peak, and duration of actions for all types of insulin. Rapid-acting insulins Lispro and Aspart have an onset between 10 to 30 minutes, peak between 30 minutes to 3 hours, and have a duration of 3 to 6 hours. Regular insulin has an onset between 30 to 60 minutes, peaks between 1 to 5 hours, and lasts 6 to 10 hours. Intermediate-acting insulin's Isophene, NPH, has an onset between 1 to 2 hours, peaks between 6 to 12 hours, and lasts 16 to 24 hours. Very long-acting insulin Glargine has an onset between 3 to 4 hours, does not peak because it works continuously, and lasts 24 hours. The answer is C. Tiotropium. Albuterol, terbutaline, and somaterol are all beta-2 adrenergic agonists. Beta-2 adrenergic agonists are a drug class used as mainstay treatments for respiratory diseases such as bronchial asthma and chronic obstructive pulmonary disease, COPD. They replicate the functions of catecholamines such as epinephrine, norepinephrine, and dopamine in producing different autonomic responses within the body. Beta-2 adrenergic agonist. They stimulate beta-2 adrenergic receptors, causing smooth muscle relaxation in the bronchial passages. Tiotropium, trade name Spiriva, is an anticholinergic bronchodilator. All of the following are examples of adrenergic agonists except dash. A. Terbutaline. B. Somaterol. C. Tiotropium. D. Albuterol. Which of the following is an example of an inhaled steroid used in the treatment of asthma? A. Somaterol. B. Fluticasone. C. Ipratropium. D. Tiotropium. The answer is B. Fluticasone. Fluticasone, trade name Flovent, is a synthetic glucocorticoid used in the treatment of asthma and allergic rhinitis. Tiotropium, trade name Spiriva, and ipratropium, trade name Atrovent, are both anticholinergics, and somaterol, trade name Serevent, is a beta-2 adrenergic receptor agonist. What class of drug is montelukast? A. Long-acting beta-2 agonist, LABA. B. Anticholinergic bronchodilator. C. Leukotriene inhibitor. D. Corticosteroid. The answer is C. Leukotriene inhibitor. Montelukast is a leukotriene inhibitor. It acts by antagonism of the leukotriene receptor sites in bronchial wall smooth muscle to prevent wheezing, chest tightness, and coughing caused by asthma, and to treat other respiratory issues to promote proper ventilation. Each of the following antibiotics works by inhibition of the 50S subunit of bacterial ribosomes except ASH. A. Macrolides. B. Clindamycin. C. Streptogramin. D. Tetracyclines. The answer is D. Tetracyclines. Macrolides, streptogramins, and clindamycin all work by inhibition of the 50S subunit of bacterial ribosomes. Tetracyclines have a similar mechanism of action, but instead affect the 30S unit of bacterial ribosomes. Polymyxin antibiotics target what part of the bacterial cellular anatomy? A. Nucleic acids. B. Ribosomes. C. Cell wall. D. Cell membrane. The answer is D. Cell membrane. Polymyxin antibiotics function by interfering with phospholipid function in bacterial cell membranes. After binding to lipopolysaccharide, LPS, in the outer membrane, polymyxin's hydrophobic tail causes damage to both the inner and outer membranes of gram-negative bacteria. What is the mechanism of action of amoxicillin? A. Interference with the 50S subunit of bacterial ribosomes. B. Inhibition of bacterial cell wall synthesis. C. Interference with the 30S subunit of bacterial ribosomes. D. Suppression of folate synthesis. The answer is B. Inhibition of bacterial cell wall synthesis. Amoxicillin inhibits bacterial cell wall synthesis by interfering with the formation of cross-links between peptidoglycan polymer chains. Which of the following class of antibiotics is associated with ototoxicity and hearing loss? A. Quinolones. B. Beta-lactam antibiotics. C. Aminoglycosides. D. Glycopeptides. The answer is C. Aminoglycosides. Aminoglycoside antibiotics such as streptomycin and gentamicin have been associated with vestibular toxicity and hearing loss. Aminoglycosides remain in inner ear fluids longer than serum and can have a latent ototoxic effect, causing hearing loss even after the antibiotic has been discontinued. None of the other antibiotics listed are associated with ototoxicity. Ciprofloxacin belongs to what class of antibiotic? A. Tetracyclines. B. Beta-lactams. C. Fluoroquinolones. D. Macrolides. The answer is C. Fluoroquinolones. Ciprofloxacin belongs to the fluoroquinolone class of antibiotics. Other antibiotics in this class include norfloxacin, levofloxacin, and natafloxacin. What is rifampin's mechanism of action? A. Disruption of cell membranes. B. Inhibition of DNA gyrase. C. Inhibition of RNA polymerase. D. Inhibition of the 30S subunit of bacterial ribosomes. The answer is C. Inhibition of RNA polymerase. Rifampin inhibits bacterial RNA synthesis by inhibiting RNA polymerase. This prevents the transcription of proteins within the bacterial cell, leading to cell death.